So, hello and welcome. I have a great friend and colleague with me today. Today, I have Britt Harris here, who's been a registered nurse for over 13 years. She's a fantastic emergency room nurse and who's also been a charge nurse for many, many years. Now, as a charge nurse, she's been responsible for following up on culture results, which is our subject today, cultures. She's also a board certified nurse coach who specializes in working with healthcare providers and first responders. So, Britt, why don't you go ahead and explain to us what cultures are and why a doctor would order them?
Yeah, thanks, Amy. So today we're talking about microbial cultures. So these are cultures, tests that the doctor may order while you're in the ER. It is a lab test where we're going to collect a specimen, so some cells, some body fluid, something like that, and we're going to send it to the lab. Okay. And in the lab, they're going to allow these, let's call them germs. Okay. Microorganisms are basically germs, or specifically, in most cases, bacteria. Okay. We're going to allow it to grow in a really controlled environment in the lab. And that allows us to figure out a few things that are important for you as a patient and for us to treat you. So, what we want to find out is bacteria present in this specimen? Okay, you can also culture for things like fungus or viruses, but those are less common. And today we're going to focus on bacteria. So, is bacteria present in this specimen? And then secondly, if so, what kind of bacteria exactly is it? We want to know what kind of bacteria it is. And the third thing we want to know is how do we best treat this bacteria? We want to get rid of it, right? So what is the best antibiotic to treat this bacteria? So those are the main things that we're trying to find out when the doctor orders a culture. So let's talk about like the cells or the specimen, what we would send to the lab. Okay. So this could be just about anything. So a lot of the time it's a urine specimen. And a lot of the time it's blood. We do blood cultures a lot in the ER. We also may collect a culture with a swab from a wound or other drainage from the body can be cultured. Okay. The other thing that can be cultured, which is a little bit less common, but we do in the ER, is fluid that's taken out of the central nervous system. So the spine, if you know, ever heard of a spinal tap or a lumbar puncture, we can pull fluid out of that space in the spine, and that fluid runs through the brain and spinal cord. And so it can be important for us to know if there's bacteria there. And the other thing is like we can draw some fluid out of a joint space and we can culture that. So there's lots of different places we can collect a culture from. Okay. And whatever specimen we send to the lab, the goal is to set up a really specific environment. They put it into a certain type of substance or a medium where the bacteria can grow, and then it can be identified. And then it can be tested to figure out what antibiotic works best on it. So that's a basic definition of what cultures are.
Great. So, but why would a doctor order it? Does everybody get cultures when they go to the ER?
Yeah, this is a great question. So let's talk about why a doctor would order cultures on you in the ER. So if you're coming in suspecting that you have some kind of infection, or if the doctor suspects you have some kind of infection, so you may have symptoms of an infection like a fever, or you have a wound that's looking really red and hot and there's pus coming out of it. Maybe you're coming in because you're having symptoms of a urinary tract infection like burning when you urinate, frequency, urgency, things like that. Okay. There also could be drainage from somewhere where there shouldn't be drainage coming out of. So, a perfect example is my own son. He gets ear infections a lot. He has been having drainage coming out of his ear. And so they wanted to
Mm.
culture that drainage. So, those would be reasons why. The other thing is, especially in the elderly population, they may not have symptoms of an infection, but they can still have an infection. And so sometimes the doctor will order cultures based on the patient's vital signs. So if someone who's older is having abnormal vital signs like low blood pressure, fast heart rate, or a fever, whether or not they have symptoms that they're telling you about of infection, the doctor may order those cultures. Okay. And what's really important to remember about cultures is that bacteria is supposed to be in certain places on our body, but there are some places we should never have bacteria growing, where it can be very dangerous to have bacteria growing. Okay, one of those places is your bloodstream. It's never normal to have bacteria floating around in your bloodstream. That can be a sign of a serious, serious infection, can lead to sepsis and death. Okay. You should never have bacteria in the fluid we pull out of the spinal column. Okay. Cerebrospinal fluid should never have bacteria present. And the same is mostly true of urine. Most normal, healthy people do not have bacteria growing in their urinary tract or in their bladder. Okay. So those are things to keep in mind. There are places in the body that we would expect to find bacteria. We have bacteria living on our skin all the time, pretty much. Now, certain types are normal to be there, other types would be less likely to be there, but we all have bacteria on our skin. We all have bacteria in our gut. We have to have bacteria in our gut. So obviously, fecal matter or poop has bacteria in it. It's supposed to. But there are other things that really shouldn't. We should never see bacteria growing. So usually we're culturing places where we're concerned that there would be infection of bacteria where bacteria ought not be.
Okay. So when can you expect the results? Like, do you get the results the same day that you go to the ER?
Yeah, so you will not get the results of this right away. So there are many tests that we draw on the ear, whether that's blood tests or certain urine tests that we get back within, an hour, maybe a couple hours, that can give us lots of really good information about how your body's functioning, and if you have an infection and things like that. But cultures take time, and the reason is that in the lab, they're putting that specimen in under certain conditions to allow bacteria to grow, and that just takes time. So there's actually no way for us to give you those results right away. So usually, if you do go home from the ER, you're going home without the results of this test. So usually within 24 to 48 hours, there's some information available. There can be, as far as like, yes, there's bacteria, it could be these certain types, but you're usually not going to get a full result for a few days, where they can actually identify the bacteria, exactly what type it is, and then test it, having the what we call the sensitivity report, where it tells us which antibiotics will work on that bacteria. That takes time. So it's usually like a few days, like 3 days.
So when might a doctor or nurse call you and say that you have to change antibiotics? Does that happen?
Yes, so that happens a lot. And I actually hear this even from friends and family who don't work in the medical field, and they'll say, "Oh, the doctor sent me home on the wrong antibiotics, and then they
Mm.
had to call me." And I just want to kind of clarify that a little bit. So when you come into the ER, let's just, for example, say you come in for signs and symptoms of like a urinary tract infection. They're going to do a urinalysis and look for signs of infection on that. And so they may see, yeah, you do have a UTI. We're going to go ahead and treat you with antibiotics. But the culture results take a few days, like we talked about. And so what the doctor's going to do is they're going to select an antibiotic that is likely to work for you based on a few things. So based on your signs and symptoms that you're telling them about, your vital signs, your medical history. Are you at higher risk for bad infections? Do you have diabetes? Have you had kidney infections in the past? Other types of information that they're going to ask you about. And then also another important thing that they're going to consider in deciding on which antibiotic to put you on is, have you been on antibiotics recently? Because if you have, then they might need to select something different than they would if you haven't been on antibiotics anytime recently.
Mm.
So the doctors are going to collect that type of information, and they're going to make the best decision they can on an antibiotic that's likely to work for the infection that you have. You're going to go home on that antibiotic, but when that culture result comes back a few days later and they've discovered it's this type of bacteria, we tested it against many common antibiotics. And when you get that sensitivity report, it looks like it shows the bacteria. It tells you exactly what type and how much. And then what it does is it shows all these different antibiotics. And next to each antibiotic, it will say either S, I, or R. S is sensitive, meaning this bacteria, when we tested it against this antibiotic, it looks like it is sensitive to that antibiotic, meaning the antibiotic will likely kill off that bacteria and it will probably work great. It can have an I next to it. I is intermediate, and it's like, it killed off some, but it might not take care of this infection completely.
Mm.
Or it can have an R next to it. R is resistant, and it means that it's unlikely to be able to have enough of an impact on the bacteria to kill it all off. And so in those cases, we usually do call the patient. So as a charge nurse, I would get these results. I would look through and take a look at which antibiotic the patient went home on, whether that antibiotic is sensitive, intermediate, or resistant. If it's sensitive, we're all good. You probably won't get a phone call from us because you're on an antibiotic that should work for your infection. But if it's intermediate or resistant, then of course we're going to take this to a physician. They're going to review it and make sure that that, if you need a different antibiotic, that they go ahead and prescribe that. And then I, as the nurse at some of the places I worked at, would be the one calling the patients and telling them, hey, we saw you in the ER a few days ago. We just got your urine culture results back, or whatever other culture. And it looks like the antibiotic you were discharged on may not take care of this infection. And so we're going to switch you to something else that we're more certain will work. And so we do have to do that. Sometimes we will call a patient as early as 12, 24 hours later if they had a blood culture drawn in the ER and there's any bacteria present, because like we talked about earlier, blood and bacteria in the bloodstream is really serious, and we don't mess around with that. So if there's a positive blood culture and the patient went home, we're at least calling usually to check on the patient, see how they're doing. And often we will ask them to come back to the ER for reevaluation, because that can be really concerning. And we want to make sure that that patient is getting the care that they need for that.
Well, thank you, Britt. That was very informative. Is there anything you want to add?
There is one other thing I wanted to mention, and that is contamination of cultures. Okay. I don't know if you've ever given a urine sample before, but usually the nurse will give you really specific instructions on how to clean yourself and give that urine sample. The reason is because we talked about bacteria normally is on the skin, right? We have different bacteria that are present on our skin. And so sometimes if someone doesn't clean the way that we instruct them when they give the urine sample, the urine sample can be contaminated with bacteria that's present on the outside, on the skin or the mucous membrane or that area. Okay. While also cultures can be, if they do come back contaminated, and usually we can tell because the types of bacteria that are present. And so that can kind of impede us being able to interpret the results. And so it's really important that patients follow instructions when we collect cultures. Okay. The other thing is that we try really, really hard as healthcare professionals when we are collecting blood cultures. We do it in a certain way so that we don't contaminate the blood with bacteria that's on the skin. But it is possible in the collection of any culture that there could be contamination at some point, whether when it's collected or in the lab. And that can make it a little more difficult to interpret the results. So that is a possibility. It doesn't happen super often because we're pretty highly trained in collecting these, but it can happen, and that can complicate the results, or they may need to be recollected.
Great. What great information. Thank you so much, Britt, for joining us today and giving us all your knowledge about cultures. Thank you so much.
Thank you. This was great, Amy. Appreciate it.
Bye,
Bye.
everybody.